first and foremost, if there are none of these rhythms present, if I test someone, I mean, for example, if somebody came into, I would suggest to most doctors, if they came into their clinic, they could just put a simple monitor on and say, sit there, calm down, now do some slow, deep breathing.
Yes.
And look to see if there's a change, right? Now straight away they've got information they never would have had before. Now, if there's no change, that's ominous. Then you look at the other rhythms in there, right?
Yeah.
And then from that you're actually able to say this person's at risk and probably why they're at risk.
I see. And that is something that the normal tests wouldn't pick up or need.
No. Well, if you think of it, I'm showing you that. Now, all the doctor or the nurse can do in a surgery, up in the corner here, is a number, heart rate 58 beats per minute. Well, that's the most you can do. If I come along, take my pulse, count it over 15 seconds, multiply it by 4, I have a number. Doesn't tell me anything about rhythm.
I see, yeah. Does this device, can it tell you about your general health conditions? Can it tell you something about other organs? Could it pick up whether you have a sickness or not?
What we're measuring by looking at the biorhythms in heart rate is what's called one of the outputs, the autonomic nervous system. Now, the autonomic nervous system at medical school I was taught about was it's a very impressive system. It's how the whole of the organs are, if you like, kept working together. Kidney, heart, breathing, and so on. And it's broadly speaking got two parts to it. What we call the parasympathetic or vagal, which is the calming, the slowing, and the sympathetic, which is the acceleration. So it's a balance.
Yes.
And that's what you can see in heart rate variation. Now, many of us today in Western society with poor lifestyle, stressed, not sleeping enough and all the rest of it, what happens is the calming side is depressed. And the sympathetic side, everybody knows about adrenaline, glucose goes up, all this sort of thing goes up, glucocorticoids, and goes up. This is an extraordinary, this is our primary, what's called homeostatic mechanism. This is how the body and the brain are kept in order. And what you can see from this is, if these rhythms are absent, then this control is going or gone. And that is a risk situation. And an infection that matters can do very quickly will affect this system. It has to. That's how the body reacts to that, mobilizes, immune responses and so on. So it has to respond, so you can see it responding. Question is, you can see, is it responding normally, failing to respond? And failure to respond is probably the thing that would worry us most, and is the background to most chronic diseases. And dare I say, these are avoidable diseases.
Yes. If it works so effectively and can tell us so much, tell doctors so much about what is right or wrong with you, why isn't it used more widely?
That remains the real challenge. What has happened in modern medicine is not just that we change the basis of investigation, but as you know better than I do, as much as I do, that what has happened is that you've got maybe 45 or more different specialties: a kidney doctor, a heart doctor, a lung doctor, a gut doctor, right? And they start to focus on organ disease, organ-specific disease, so they have tests for that organ. And most of these people, I'm sorry to say, know very little about this. But this is 100 years old, 150 years old. This is not new science. Our ability to measure it easily, that's what's new. And what we're really asking you to do, in fact, I was having a meeting yesterday, and somebody said, isn't heart rate variable, isn't one of the problems it's old-fashioned, isn't it? Well, Buddhist medicine that's pretty old-fashioned. It's only a few millennia. and they got an awful lot of things right.
Yes, yes.
And the beauty of this measurement is it measures many of these: meditation, breathing, Tai Chi, yoga. I've measured all these things, and it's very, very impressive how these old practices, in fact, improve the autonomic nervous system.
Are you hoping to do some studies here in Thailand on how measured breathing can affect your health?
Yes, I'm going around, in a sense, banging on doors. I would like to engage more than I've been able to do with academia here in Thailand, and with the Thai government, because, as I mentioned, their health policy here is one of the most impressive in the world, because they decided in 1980 that modern medicine was not working, and it was too expensive, and it did not cure lifestyle-related diseases. I mean, they hit all the three big buttons in 1980, and decided that what they were able to do it was to consider fusing traditional medicine and modern medicine, because, don't get me wrong, modern medicine has had some extraordinary discoveries, but what is the point of having extraordinary discoveries if you like ignoring or allowing people to develop avoidable diseases? Yeah. Now, that's not just modern medicine. This is society. This is a society that has to make a decision. Thailand made that decision,
yes,
but they're keeping it a secret.
I see. You said in your paper that there is a pandemic of lifestyle-related diseases that are sweeping the Western world anyway, and perhaps undeveloped countries as well. You say that if we could conquer those lifestyle-related diseases, our health costs would be reduced by 2/3. That's an amazing figure. You're saying that if we changed our lifestyles, our health costs would go down by 2/3?
On the assumption that you could get all the people to change their lifestyle, yes. But dare I say, the cost of those are direct costs. Those are healthcare costs. The cost to society and the economics of any modern country. And let's get away from modern, because this is a global problem now, no question about it. This is global urban society is in serious trouble, and it's completely disrupted normal lifestyle. And ask yourself, as I asked myself when I spent a day in Bangkok, how can I live normally in Bangkok or London or anywhere else? It's strife.
Yes, yeah. But even so, and you've been quite critical of Western medicine or modern medicine, we're still living longer than we used to, right? We've conquered many diseases, smallpox, we can get vaccinated for many diseases, and in many ways we've developed tremendous skills in surgery. Surely those accomplishments have been something that we can take some pride in and enjoy the benefits of them. Western medicine hasn't been totally negative, surely.
Absolutely not. And in terms of in some of the major infections, absolutely not. I mean, I've been involved and enjoyed being involved with some startling developments in modern medicine. But let me just take you back to surgical techniques. Dare I say, what is the point of doing super surgery on people that shouldn't have had the problem in the first place? Heart disease, vascular disease, strokes. Why are we rescuing people from conditions that they shouldn't have developed? And it's within their power. Rather, it's within society's power to do. And probably I and others should move away from criticizing modern medicine. Modern medicine is really chasing its tail. It's chasing society's tail. It's society that's got to decide, make a decision. In these huge cities, for example, will they afford to allow people to live a reasonable lifestyle, right?
Yeah. What are some of the lifestyle changes we should be making, Dr. Johnson?
Well, the, dare I say, diet, and dare I say, activity. Now, these are well known. I mean, the Western approach to lifestyle is that, dare I say, it is a mindless approach. Diet and exercise, diet and exercise. Get those right and you'll be okay. Fact is, if you get them right, you do make major improvements. But where's the mind in this? All the evidence is it's the mind and the stress and the poor living environment that, if you like, gets to the mind first.
Right.
What Buddhism knew, what Buddha knew, and this is why we need to measure this, is that how you use your mind to control your body. And to me, this is the thing that we have missed. It's coming out. It's coming out in modern science. But when I say pandemic, 2/3, and there's no argument. This is not just my story. There's no argument about that. These are massive costs. And you've got, politically, you've got governments like ours in the UK say, we will have year-to-year increases in the healthcare budget. It's sacrosanct. All they're doing is chasing an increasing number of chronic conditions. And when you said just now, well, we live longer, well, tell me why the United States life expectancy ranks at 38 in the world.
I can't tell you.
Lifestyle.
Okay.
Lifestyle. I mean, a lot of the American lifestyle is absolutely appalling.
Okay.
The obesity level, they lead the world comfortably in obesity. The United Kingdom is the worst in Europe.
Yes.
So some of the people that have much vaunted modern healthcare systems have actually some of the worst outcomes.
I see. So you think that even though Western medicine and the Western world recognizes the importance of lifestyle, the factor that they are missing is emphasis on the mind, which you think is important?
I mean, in my 2 years here, I mean, I put my hand up and say, mea culpa, why didn't this dawn on me in 40 years of doing this, especially when I've been looking at the interaction of the mind and cardiorespiratory control. But maybe better late than never.
Yeah.
But mind and breathing is probably one of the biggest links. And if you think about it, it's certainly something we have control over if we think about it.
Yes, yeah.
We don't think about it.
Yes, okay. Well, I think that's a great point to finish. So thank you very much, Dr. Johnson, for coming and talking with us here today. And thank you for listening. If you have any questions or would like to contact Dr. Johnson, please email me at healthbodyandspirit@gmail.com. Thanks for watching Body and Spirit, a Buddhist approach to health, mental and physical, and I hope to see you next week. Thank you.